Hi, my name is Karen Blake and I'm an equine surgeon. I'm here at CSU right now to chat with you about non-weight bearing injuries. This particular horse is sedated for demonstration purposes. So if your horse has a non-weight bearing lameness suddenly, typically you notice that the next morning or when you get home from work, and that can be really distressing for clients. So there's some good things that you can do to assess your horse, to assess what's happening, and things to prep for before you call your vet. So the first thing that you're going to do is you're going to look at your horse and you're going to assess their condition. So are they feeling stressed? Are they sweaty? Are they doing some rapid or heavy breathing? Does the limb have swelling? So, and if they have swelling, is it just at certain areas of the leg? Is it up through the whole leg? Do you see focal swelling on the upper leg? Those kind of things are really important to try to decide where that lameness is coming from. Other things that you can look for are heat to the limb. So if you don't see any swelling of the leg, are you feeling heat in their foot? Is there certain areas that might be depressible to your touch? So if you have swelling, sometimes as you put your fingers on the horse, that will indent into the tissue. That's called pitting edema, and that can often accompany lots of different things. Other things you can look for are obvious trauma to the leg. So is there some bleeding that you notice on the leg of a potential area to investigate? Is there a puncture wound into the tissue there? Is there a defect in the leg? So if you have a laceration to that area, where does that extend to? Typically when the horse is non-weight bearing lame, they will be toe touching with that leg as they walk or standing there. If you notice that the horse is absolutely not putting any weight on the leg, or if you notice any incongruity to the leg, so if there's a wiggle to the leg, that's something that's concerning for a fracture. And so you need to keep that horse in the same location if you can. Try to keep them calm, and while you call your vet to let them know that you have concerns that the horse might have a fracture because of that, that instability of the leg. Other things you can do if you're not seeing a lot of outward signs of a problem, you really should pick up the foot and take a look and see if there is anything penetrating into the foot itself. So is there a nail or a screw that's involved in the foot? If so, then we try to keep that screw or nail in the position. It's always instinct to try to pull that out because we don't want anything stuck in the foot, but those can penetrate into really vital structures in the foot, so the navicular bursa, the tendon, or even the bone. And so that's really important information for us to get as veterinarians. So we want that to stay there so we can see how deep that injury is. Other things that you can do, especially while you're waiting for your veterinarian, would be to take a physical exam. So ideally, if you could have a stethoscope on hand so that you could listen to their heart rate. The place where you listen to their heart rate is right behind their elbow. And typically you have to push in a little bit in between their elbow and their rib cage to be able to listen to that heart, okay? So you push it in here, and remember to listen for a couple of seconds. Horses' heart rates are typically slow. Now, if they're injured and they have a severe non-weight bearing lameness, they may have an elevated heart rate. So what you're gonna do is you're gonna stick your stethoscope on that area. You're gonna be listening, obviously, and counting. If you can use your watch to count for 15 seconds, you can then multiply whatever number that you counted by 4, and that will give you the horse's heart rate. Typically, horses have a heart rate between 30 and 40, so if you're getting higher than that, that's concerning. The other thing you can do would be to take the horse's temperature. We typically use a digital thermometer for that. And if they have a fever that would be considered over 1015, then that's concerning for infection in the leg. Other areas that we get really concerned about for non-weight bearing lamenesses specifically are when you have a puncture wound that could be over the joint, and especially in the lower limb, that can be involved for synovial or joint puncture. And so those injuries are life-threatening and they need to be assessed very quickly in order to preserve the life of the horse. If you do have an injury into the tissue, so if you have a laceration or a puncture wound, it's ideal to try to get that horse to an area where it's clean and flat and a dry space. The other ideal thing to do would be to try to cold hose that area, because horses live in a very dirty environment, and the sooner that you can get that dirt or debris off of the horse and off of that injury, the better. Not every horse will allow you to do that. This particular horse is sedated right now, and so oftentimes we do need to use sedation in order to do that, so don't get injured. But it's better if you can get less contamination on those injuries. They're less likely to develop infection and they're going to heal better. If your horse has instability of that leg and a fracture, you really don't want to move the horse, because that's going to agitate the fracture and could displace it or cause further soft tissue injury. So keeping the horse calm, keeping them as stationary as possible while your veterinarian gets to you. Again, there may not be a lot that you can do in those instances, but trying to stay calm and trying to keep your horse calm are the best thing that you can do. So another non-weight bearing issue that we deal with frequently, especially at the podiatry center, is laminitis. So laminitis is typically exhibited by the horse refusing to move. They may or may not have a non-weight bearing lameness. Occasionally they do. Typically you're going to feel some heat in the feet. You may even feel for a digital pulse, which typically we can either feel here at the back of the fetlock, or sometimes you can feel here in the pastern. Oftentimes, again, they're gonna have that heat in the hoof. Sometimes they may or may not have swelling. Oftentimes they're laying down excessively. They may have difficulty turning or walking on gravel. And so those are some things that you can look for. If that's the case, if you can move them to an area that has soft footing so that they can feel more comfortable, or lay down if they choose to, that would be helpful.